Have you ever studied about hydrocephalus? I know you have studied. So let's revise. So basically, what is hydrocephalus? Before we move into this topic, we need to know about CSF, its drainage. What is CSF? CSF is a clear fluid which is formed by the choroidal plexus of the ventricles of the brain. How many ventricles do we have? The question is. We have four ventricles, two lateral, third ventricle, and the fourth ventricle. Two ventricles are connected to each other by a foramen, which is foramen of Monro, right? Third and the fourth ventricle are connected to each other by the duct, which is aqueduct canal of Sylvius. Aqueduct canal of Sylvius connects the third and the fourth ventricle. If everything goes normal, there is no overproduction and proper drainage, there will be no signs of hydrocephalus in the children, right? But what happens if there's a blockage? So, in pediatric population, the most common cause of the non-communicating hydrocephalus has been observed as the stenosis of this aqueduct of stenosis. Right? Aqueduct of Sylvius का क्या हो जाता है? Stenosis. Stenosis means narrowing. So there will be production, but there will be no proper drainage. As a result, what happens? There will be enlargement of the third ventricle, and then later on there will be enlargement of the lateral ventricles of the brain. Subsequently, when there is expansion of fluid inside the brain, the head of the baby gets enlarged. As you can see on the picture, the head of the baby who are suffering from hydrocephalus are having macrocephaly. Another clinical feature of the patients with hydrocephalus is the sun setting sign. As you can see on the screen, this sign is called as a sun setting sign, and it is a classical feature of the hydrocephalus. I hope it is clear. Later on, the children will be very irritable. The children will not feed properly. The children will continuously cry or maybe drowsy at times, right? And one more thing, that there will be a bulging of the anterior fontanelle. We have studied, baby's head has soft spots which are formed by the junction of the sutures, right? So the anterior fontanelle, which is not closed yet in the neonates, will start to get bulge as a result of increased CSF production and accumulation inside the brain. So once there is a clinical manifestation, the client will come to you. Now, how you will diagnose that this child has hydrocephalus? Number one, it will be very much prominent from the physical examination, but to make a proper diagnosis, as the anterior fontanelle of the children is open, a transcranial ultrasound can be done. Number one, as a diagnostic modality. Number two, what else can be done? The next thing that can be done to diagnose it completely is the MRI of the brain. MRI stands for the magnetic resonance imaging. Okay, to clinically diagnose it. Now, the child came to you, child had features. Now you have diagnosed that this child has hydrocephalus. How will you manage it? ठीक है, इसका हमारे पास दो मैनेजमेंट्स आती हैं. एक होती है कंजर्वेटिव मैनेजमेंट, एक होती है proper management. Proper surgically, it is being creation of the path which is called as a ventricular peritoneal shunt. ठीक है, वीपी शंट बोला जाता है. शंट में क्या होता है? वेंट्रिकल्स में जो CSF प्रोड्यूस होता है उसको शंट, उसके पाथवे को शंट करके पेरिटोनियम में ड्रेन करवाया जाता है. बट व्हाट इफ द केसेस आर बिजी, द चाइल्ड कैन नॉट बी इमीडिएटली पोस्टेड फॉर अ वीपी शंट. What can be done? Primarily in the cases, hypertonic saline can be given. Okay? And I have not seen any pediatric population receiving the mannitol. So 3% saline is only the hypertonic solution which is primarily given to the neonates at a very low dose, right? So this was all about hydrocephalus. I hope this video was informational for you. Do like, share, and subscribe to our channel for more educational content. Do hit the bell icon so that you get notified whenever we post the new content. Thanks for watching.